Did you know that there is a condition that not only affects women's health, but also can affect a woman's ability to have children? Welcome back to my channel. Today we're talking about something called PCOS, Polycystic Ovarian Syndrome. It sounds complicated, but do not worry. We're going to break it all down. Me, you, PCOS, let's go. Okay, so first thing is first. What even is PCOS? Okay, so without boring you with all the medical terms and jargon, let's put it in simple terms. PCOS is a condition that affects your ovaries. And what happens is your ovary starts to produce this excess guy hormone, androgen, essentially. It starts to produce an overproduction of androgens, which throws everything out of whack. And we are going to dive into how next. Okay, so now what are the signs and symptoms of PCOS? So we're going to break those down. Number one sign are irregular menstrual cycles. Sometimes your menstrual cycles are here and sometimes they're not. PCOS tends to cause people to have less periods in a year, which essentially is linked to infertility, which we'll dive into more later. 2, acne. Acne that's very stubborn, that just does not seem to budge. And a lot of times they pack around here. This is a sign of hormonal acne. 3, hair loss. Hair loss in places where you do not want them, right? So places such as the center of your head, you lose hair there. And then hair growth. Hair in places where you actually do not want them, okay? Such as your face, we call it hirsutism, or your chest, your back. I know, it's so confusing. Hair in places where, well, not confusing, it's so annoying. Hair in places where you don't want them and losing in places where you do. And that's not all. There are also some people who develop cysts, harmless cysts on their ovaries, okay? And a lot of times it's used to diagnose people who have PCOS. So we'll talk a little bit more later on about cysts on the ovaries relating to PCOS diagnosis. So now you're probably wondering, well, what causes PCOS? Unfortunately, we do not know, all right? But what we do know is there is a link to genetics and also how the body regulates insulin, okay? Insulin is the hormone that regulates sugar. So we know there's a link between genetics, okay, and how your body regulates insulin. Okay, so how do we actually diagnose PCOS? So providers, we tend to use 2 out of the 3 rule. If you have 2 out of these symptoms and signs, then you have PCOS. So the first one is a regular menstrual cycle. Okay, so if you're having less menstrual cycles in a year, that is one sign or symptom that we go by. 2, high androgen. Now, high androgen can be either done through a blood test or signs such as the hair, the acne, just signs of high androgen levels on you, like we can actually visualize it. And 3, cysts on that ovary. So we use an ultrasound to see if you have cysts on the ovary. If you have 2 of these 3, then we diagnose you with PCOS. Now, if you have a cyst only on your ovary, that does not mean that you have PCOS. That could be related to other things such as endometriosis, which is why we always use the 2 out of the 3 rule and not just 1. We'll talk later on about endometriosis. Okay, so you're like, so what if I'm missing periods? I got a few acne and, maybe I'm losing hair or have hair growth in places I don't want it. So what? Well, unfortunately, PCOS does not only affect, your cycle or your fertility. It can also be linked to serious health issues such as heart disease, such as endometrial cancer, such as diabetes. And the link to some of this is simply because, let's break it down a little bit. If you are having less and less periods in a year, that means your uterine lining is not shedding all the way every month as it should. And that can cause your uterine lining to get thick and thick, which can put someone at risk for endometrial cancer. Another reason why it's linked to things such as diabetes is if you have insulin resistance, okay, the chances of you developing diabetes, because we know that diabetes and insulin are related, is also high. So not cool, unfortunately. So let's talk about PCOS and pregnancy. PCOS is one of the leading causes of infertility in women. And the reason behind that is because of having less chances in a year to ovulate. Less periods mean less ovulation, okay? And also, if a woman with PCOS gets pregnant, it increases her risk of having complications such as miscarriage, such as gestational diabetes, such as preeclampsia. But not to worry, there are treatments. More of that in a second. Okay, so what can be done about it? It is not all doom and gloom. We're going to talk about all the possible treatments, from things you can do at home to the things that providers can do for you. So the first thing is lifestyle change, diet. Many research have confirmed that even a small 5 to 10% weight loss in a woman with PCOS can greatly increase her chance of fertility and also insulin resistance, reverse her insulin resistance as well. Okay, so you're thinking, what if lifestyle is not enough? Well, that's where we turn to medications. Medications that are helpful in helping with ovulation, the insulin resistance, such as letrozole, Clomid, metformin. They have helped a lot of women. And then, if that's not enough, there are procedures that can be done in helping the ovaries work better, such as a procedure called ovarian drilling. It sounds really terrible, but I promise you, it's not. At the end of the day, PCOS is just a part of a woman's story. If you have PCOS, it's just a part of your story. With the right treatment, you can manage it. Thank you so much for watching. If you have any questions, leave a comment down below. Share this with your family and friends for PCOS Awareness Month. Thanks for watching, and I will see you next time. Bye.